Hello everyone, welcome to my channel. My name is Dr. Flyer. I'm an anesthesiologist and critical care physician. So today we're going to talk about labor epidurals and answer whatever questions that you guys have as far as being pregnant, going into labor, and wanting pain relief in the form of an epidural. First question, when can you get your epidural? The answer to that is pretty much whenever you want, whenever you're not able to handle the pain anymore. There is not a certain centimeter number that we're shooting for. That's all old school. These days it's about comfort. So if you're 3 centimeters and you are squirming and in pain and you want that epidural, ask for that epidural. Number 2, it is a continuous infusion. It is not a single shot where we inject you with some medication and then it's done and it lasts so long. We put a catheter there and then it's hooked up to an IV bag and it's continuous infusion like an IV bag, and it's giving you medications to keep you nice and numb throughout your labor and to delivery. And then if the surgeons need to sew you up, even through that, and then the nurses take it off or the anesthesia team take it off. So it is a continuous infusion. It does not run out. It doesn't wear off, which brings me to the next point as far as people who say it wears off. What happens is the nerves that supply the vaginal canals tend to be the larger nerves in the lumbar area. Lumbar area is the lower back. And so those nerves can be hard to anesthetize, as in those nerves can be hard for the medication to go into the nerves, absorb into the nerves, and give you that pain relief. So what you'll hear people complaining about is like, my epidural worked up until it was time to push and then I felt everything. There's a lot of pressure. You feel probably some pain. But the only way to really know that it worked versus it didn't work is if you have a natural delivery versus a labor epidural delivery. And then oftentimes is when people realize there was a big difference actually. And I did have some pain relief with my labor epidural. Now, those are the people who complain about it not working actually during pushing out the baby, during the whole ring of fire. Because some people don't feel a thing, just, some pressure, which we will not take away the pressure, but it's not uncomfortable even when pushing. So you never really know which batch you're going to fall into. Point number 4, do we go in the spinal cord or close to the spinal cord? Well, we do not go at the level of the spinal cord. The spinal cord ends somewhere around L1, L2. L again is lumbar. And we usually go between L3, L4 or L4, L5. So this is where the spinal cord ends, and these are the little nerves that come off the spinal cord at the bottom. And where we're going down here somewhere away from the actual spinal cord, so we're not risking damaging your spinal cord. And these nerves down here, okay, that are coming off of the spinal cord and supplying your legs, your vaginal area, all that good stuff, those nerves tend to move out of the way when we're introducing that little plastic catheter into your epidural space. So that's another thing. You might feel some little zingers going down your legs during the epidural placement when we're putting that catheter in there, but we're not poking through the nerves. We're certainly not poking into your spinal cord. Next question, as far as is my epidural always going to work? I tell my patients that there's about a 5 to 10% chance of it not working or working well. You could have what's called a patchy epidural, one-sided epidural, where you have one side that's nice and comfortable and the other side you're still feeling stuff. Or it could be patchy and blotchy. Now you're having some pain relief here, but you still got a little corner down there that's not working well. It's because we do this blindly, as in we do this with anatomical landmarks. We don't have x-ray. Most of us are not using ultrasound. We're doing it by feeling the bones. We're doing it by feeling your anatomy, and we're doing it by feeling this pressure in the syringe that we're pushing when we're putting in the epidural itself. So there is a failure rate, so there is no guarantees that it's going to work. And typically what happens with me is a lot of us, we just try to manipulate the catheter, maybe pull it out 1 or 2 centimeters or something, and sometimes we just have to replace it. Every time I've replaced it, it's worked. When I maneuver the catheter, sometimes that's helped and sometimes it hasn't helped. Okay, point number 5. This epidural does have a tendency to drop your blood pressure, and that is why the nurses want to give you IV fluid. It's part of our protocol. We give you a big bag of IV fluid, what we call a bolus, which is 1 liter of IV fluid to tank you up, to basically kind of bring up your blood pressure, so that when we give you that epidural and your blood pressure drops, it's not going to drop as much. Because if we drop your blood pressure too much, which still sometimes happens, but not that often if we tank you up, what happens is you may feel queasy and nauseated, and your baby may transiently meaning it doesn't last very long, may have a period where the baby may not be getting enough oxygen. So that's why we really just want to make sure that we don't drop your blood pressure too much. So we want to give you some IV fluid boluses, and then we sometimes need to give you some blood pressure medication if your blood pressure still drops. And I think that's it as far as my notes covering all the epidurals. Talk to your OB when you guys go to your appointment. Ask about pain relief. It seems like some of that is not happening whenever you guys are going to your prenatal visits. Talk to your OB. Ask them about the different modes of pain relief that you can get. You can get some IV pain medication. Some places have nitrous oxide, but in this situation, I'm specifically addressing the epidural for pain relief. So please leave your comments below and let me know what questions that you further have. Thank you.